Welcome back, Jamie.
Thank you, Jamie.
Okay, so when you came in to do this work, you mentioned that your overall goal here was to work specifically with food. And the actual goal you gave me, I'm just looking back at our notes, was to be able to plan ahead better, to have more appropriate choices for me. And we did some past work along this theme of comfort food and deprivation, looking at this past target, eventually getting you to this positive cognition of I'm okay.
Mm-hmm.
So what I'd ideally like us to do on this future template is to see, can you bring up a future scenario as it relates to food? Something that is likely going to happen, maybe even in the next day or the next week, that relates to you needing to make a choice around food. Is there a future scenario connected to food that may be coming up here in the next day or even in the next week that maybe we can take through this future scenario?
Well, especially if I haven't planned ahead for lunch, then I tend to grab whatever's available. And so I'm better off if I plan and have, especially enough veggies with a little bit of protein.
Okay.
Staying away from most of the carbs.
So what I'm hearing is not planning ahead, potentially being a pitfall.
I get too busy. I maybe stay up too late at night attempting to work on things for the next day or for later in the week. And so I don't necessarily prepare anything in the evening. And then I might sleep in till the last minute so that I'm fairly rested. And so then there's no time, and then don't necessarily, depending again what's available, I don't necessarily have time to prepare much of anything.
Okay, so I'm going to use this idea of the need to plan ahead with food, because you've identified that that's a need for yourself as our future scenario. So when you think of that as your intention, like needing to plan ahead with food, is there an image or a worse part that is coming up that maybe represents what gets in the way of you planning ahead? Maybe you just gave me some examples, like getting too busy.
Too busy, yeah, kind of losing track of time sometimes in the evening. Off and on, I have set a reminder or set a timer because I'll get so in the zone working on something that I just don't realize how much time's gone by.
Okay. So is that what seems like the worst part of what keeps you from planning ahead? Being so in the zone working, not realizing how much time has gone by.
Sounds right.
Sounds about right?
Or at least a big part of it.
Okay. So when you hold together the positive belief we arrived at of I'm okay, even with this worst part of the future scenario, it's a tricky question, but how true does I am okay feel right now, 1 to 7? Even as we're talking about these things that get in the way of you planning ahead.
Well, I'm not as okay if I don't plan ahead a bit. And I am more of a person, I do like to plan, but I feel like I've also gotten better over the years at going with the flow. And maybe that's the, what is it when they don't make sense?
Yeah, just go with that. Right? What are you noticing?
At some point wanting to be better at going with the flow, and that it's going to be okay, except if I don't plan ahead to have appropriate foods ready for me, it's not going to be okay. Does that make sense?
Just go with it. Again, we're not judging,
Judging.
and this is
Okay.
way more of an open-ended process than the main target. So see where you go with it.
Becoming aware that some people quite a long time ago had said something about I was too structured.
Mm-hmm.
But if I'm not structured enough when it comes to the food, then I'm not okay.
Mm-hmm.
Because physically I start feeling not up to par.
Mm-hmm.
I start feeling sick even at times if I eat too much stuff,
Mm-hmm.
junk.
Go with that. Right. What are you noticing?
It's okay to plan ahead at times,
Mm-hmm.
especially getting appropriate food ready so I can function better.
Mm-hmm. And can you hold that together with your positive belief of I'm okay, like at an existential, deep level?
Okay.
Okay. See if you can hold those together, and
Mm-hmm.
you'll notice what happens. What are you noticing?
I am okay. And it is okay for me to plan ahead,
Mm-hmm.
especially when it relates to food.
Okay. Just roll with that. And what are you noticing?
Okay.
Okay. Would you say on the scale of 1 to 7, 1 being completely false, 7 being completely true, where would you rate it
7.
as you hold this future intention in mind? Okay, let's lock it in at a 7. Keep breathing, keep noticing the body. So you can go ahead, give me the headphones back, and kind of moving forward from here, I would encourage you to just continue to notice how that's playing out in life. Something that resonated for me was I hear a statement like, I'm okay, which is your positive cognition you came to, and that goes along so well with this idea of self-compassion. And at least a connection I made was maybe looking at the art of preparing food for yourself as a practice of self-compassion. And just notice what you notice, like we do in EMDR, see what happens in life, and then when we check back in, we can see if there's anything else with this we may need to tweak or reevaluate. Okay, thanks again, Jamie.
Thank you.